everyone, happy evening, a very good evening. I hope and I believe all of you are doing well. A quick nod whether I'm audible and visible to everyone so that we can start with this very important session on this Sunday. Am I audible and visible, everyone? Hi, John Abbas. Thank you so much for those kind words. We'll definitely do that. Yes. Okay. That's great. Thank you for that approval that I'm audible and visible. So yes, happy evening, everyone. Happy Sunday evening is what I would say. And you are here on a Sunday evening, and that proves that you are dedicated to make your dream come true. So yes, learners, we are going to discuss about the do's and don'ts during your NEET PG preparation, because have been through that, and I can totally understand that how much important it is to get the right guidance. I don't want any one of you, to start working and then at some point of time later realize, oh, this was something that was not supposed to be done, and then I don't want anybody of you to regret. So I believe that majority of the students who are the interns would be starting or would have just started their preparation, and you are at the right time, at the right place to understand what to do and what not to do when you are preparing for the NEET PG. And at the outset, I would like to say that it's not very difficult as it seems. On one hand, you would see the students who are struggling to crack the exam, but on the other hand, you would also see the students who are cracking the exam with very good ranks in the first attempt. Right. So that means that it is very much doable. It's just the right strategy that is required in place. Thank you so much, Aditya Moti, for those kind words again. Uh, Okay, so first of all, I know that majority of the students who are here for NEET PG 24, the first question that you have is, ma'am, whether this is NEET PG 24 or whether this is next 24. Let me tell you, I am as unaware as you all guys are कि ये NEET PG होगा कि ये next होगा. But one thing that we all know is, and I want to reiterate that is, your syllabus is not going to change whether it is NEET PG or it is next, right? So what you need to work on, yes, Nadia, that's what I said. I know that was the question that was supposed to be there. So don't worry about that. And in the process, please don't wait कि जब एक बार announce होगा कि NEET PG है कि next है, then I will start preparing. So by that time, you would have already lost the game. So please don't lose out on any time that you have. It's about building the concepts, and the syllabus is going to the same as I said. So nothing is going to change. So you have to prepare like you are going to prepare for NEET PG as well. Okay. Okay, thank you so much, Qureshi Faisal, everyone here. Right, so whatever queries you have related to your preparation, whether this is your first attempt or this is not your first attempt, please write down your queries in the live chat. So, beach mein I'll keep seeing on your queries and I'll be answering those as well, right? So, you need not worry about any difficulties that you are facing during your preparation, right? So, talking about the do's and the don'ts of the NEET PG preparation, right? Okay, so first one that I would like to say is direction is so much more important than the speed, right? It does not apply just to the exam preparation, but also in our life as well, right? So let's say that you are going somewhere, and but then you realize that all the while that you were traveling, you were spending your petrol, right? You are going in the you are going in the wrong direction, and then I'm pretty sure that you would not feel so good about it. Same thing applies here. You are studying, you are trying to study for 8 hours, you're trying to study for 10 hours, you're studying for 4 hours, whatever time you are getting out of your internship, out of your work, you are studying. But then, as I said, you would realize कि ये तो करना ही नहीं था, where this was not supposed to be done. So that's why direction is something which is much more important than the speed at which you are studying. You know, how much is not as important as how good you are doing in a day. Quality, much more quantity. So if anybody has a question that, ma'am, how many hours in a day should we study if we have to crack NEET PG? There are students who crack by studying for 12 to 14 hours. There are students who crack by studying for just 6 hours. You know, so it all depends on how well you have studied in your MBBS years. So comparatively, you would require less number of efforts, less number of hours and less efforts. If you think that I did not study that well in my MBBS years, I don't have my basics very clear, then probably you will need more time But I'm pretty sure that all of you who are here into MBBS, you are like, some of the best brains in the country, and that is why you are where you are. So first of all, I want each one of you to give a pat on your back, because wherever you are, there are so many people who are envious of you wherever you are, who are dreaming to become doctors, and you are already in their shoes, right? So be proud of yourself, even though you have not been able to crack NEET PG in the past. That really does not matter. Okay, I see a lot of queries pouring in, especially the long queries. So please give me some time to read those queries. First, I'll tell you the timetable, my point of view, and then I will be coming to your queries as well. So just be some patient to come back to your queries. Okay, so there we have already answered the question whether it is next or it is NEET PG 24. Okay, so starting with this one, see, whenever you're preparing for anything, not just exam or anything in life, the most important thing is your why should be clear. Why do I want to do this? Until whatever you are doing is not backed by the why, by that burning desire. Because I want to be a very good doctor, maybe I want to be a very famous doctor, maybe I want to be a doctor whose bank accounts and pockets are always full. There is nothing bad about that. Whatever is your motivation behind that, first thing that I want all of you to do now is just close your eyes and ask yourself, why do I want to pursue the preparation for NEET PG or INI-CET or FMG, whatever exam it is? So once you get to know that, probably it will get you into a good position, right? You will be able to serve your patients much better when you specialize in a PG branch rather than being a general physician, right? So let your why be very, very clear. And as I always say, if you have a burning desire, not just a desire, I don't just want it, I want it very, very badly as I need oxygen to breathe and to live. So until and unless, your why does not become so, crazy like a burning desire, otherwise everything seems so effortful. If your why is very strong, you will not feel tired while you are studying. Trust me on that front. If your why is very, very clear, you are doing it very passionately. I am doing it because I want to do it. I am not doing it because my parents are doing it. I'm not doing it because my friends are doing it. I'm not doing it because this is like a race. MBBS kiya hai to PG to karna hi hai. If anybody of feel, that is the case, still you have time. If you think that you were not meant to be in this medical branch, I should honestly not be telling this in this session, but I believe that this is the right time as well. You think that over the years you thought that MBBS, being a doctor, is for you, but then you're realizing, this is not meant for me. You still have a chance to have a career change. Okay, so first is knowing the why. Second most important thing is knowing the how. How should I do it? Now, from where does this how come is from your seniors who have already cracked the exam. Yeah, right, including me. So yes, not to boast about, but to tell you that yes, I cracked my PG entrance exam in the first attempt itself, along with internship, and got a rank of 10, and then went on to pursue MD radio diagnosis. So I always tell that if I can do it, you too can definitely do it. Right? So it's not just me. We have the best of the faculties here in the Prepladder team, the Dream Team Next Edition, who will always be there by your side to tell you that how to do this. So whenever you have any queries, please feel free to reach out to us. We shall be more than happy to tell you, how you should be doing a particular subject. So we have the subject specialists, so make sure you take their help and you take their guidance to crack this, because how to do this is very, very important. Like I said, there's an ocean of information, an ocean of knowledge, an ocean of resources available all over. And honestly, you don't need to do anything of that. I believe that being in this digital world is like a double-edged sword. It has its own pros and cons. Like we had just the books. So we were, I think, at much better peace कि हमको इतना ही पढ़ना है. But at the same time, with all the online resources, it has become so much easy and so much accessible. You just have to carry your phone wherever you are going. During your internship also, you are, accompanying the patient. You are going to get the reports. All you need is your phone. You don't need to carry those heavy books, right? So that's the good part about that. And the best part, you don't need to travel anywhere. You can read from wherever you are in the world. So that's the best part about it. So make the best use of it. So once your why is clear, the how is clear that I would be talking about in this session, Then comes your role in being consistent, right? Then comes your role in being consistent. That is the most important thing. No matter what, until you reach to your dream, until you reach to your goal, please do not give up. Let me warn you at the outset itself that there would be many days and there would be many instances where you would feel that this is like, so boring, this is tiresome, I don't feel like doing it. But trust me, if you persist, you will see the magic happening. So, as I always say, the universe falls in love with a stubborn heart, and let you be that stubborn heart, and please persist and stay consistent. At the same time, it does not mean that you need not take breaks while you are preparing. You should be taking breaks. So I'll be telling you, I'll be showing you the timetable as well, where I've given you good enough break days, free times, basically because I don't want any one of you to break down if you don't take a break, right? So I'll be telling you the entire timetable as well. Okay. So yes, some queries which I can see is all of these I'll be talking about, and as I said, I'll be coming back to all your queries. If any of those queries are left unanswered, I'll be taking up your queries as well. Okay. So going on to the next one. So if you have been with me since a long time, this is a timetable that I had shared on my YouTube channel as well recently. So we have already started following this timetable. So just not to add to the confusion, the already so much existing confusion, I'm giving you the same timetable so that the students who started following this timetable can continue with the same. For the students who are not on track yet, who are finding it difficult to stay consistent, let me tell you, there are thousands and thousands of students who are following this timetable together. So you can join the group and you can start following the targets that are being shown here. So actually, we started this timetable on 16th of May. So you are not very late, I would say, if you have not started this timetable yet. In the break days, you can cover up the days that you have lost on if you are starting from tomorrow also. Right. So the timetable basically is this is going to go on till October 17. I'm not giving you a timetable which will be like next 3 months ki July or August tak khatam kar do pura timetable, because let's be very realistic. If you give yourself those unrealistic targets, starting में enthusiasm ज़्यादा होगा, एक subject कर लोगे, दो subject कर लोगे, तीन subject कर लोगे, but then you will start feeling the burnout. So I know that definitely happens, and that is why I have given you a timetable which is giving you enough time, whether you are an intern, whether you are working, and for the students who are prepared before as well, you can actually complete the timetable twice in these time duration. So for the students who have already finished the syllabus, that means they have given an attempt in the past, you can shorten this timetable and actually you can divide it into two halves and complete two readings rather than doing just one reading, right? But otherwise, for interns and those who are working, this is the timetable that you should be following diligently. And like like a very lenient educator here, I have given you all the Sundays off. You can see here 21st May Sunday, which is today, is off basically. 28th May, 4 June, 11, 18 June, basically all the Sundays of the month I have given you off. Is the screen not visible very clearly? Never mind. I'll be sharing this timetable separately as well on the Telegram group as well. So you would get a clear idea there. Is it any better now? Can you tell me whether it is any better now? At least a part of it? Yes, Priya. So for the students who are preparing for INI-CET, they can also follow this timetable. But as I said, for those students, this should be actually two readings. So if I'm giving you 8 days for anatomy, actually you should be completing in 4 days. So this is double the time or what you should be doing. Okay. So for whoever feels that the screen is not clearly visible, I think you are like me where you need to change the quality of the video. Go to quality advanced and make it at least 360 pixels. I think you will see it better then. Okay, that's visible then. Okay. So yes, we have started with anatomy. That is what I was telling. And the anatomy, we are still on the first subject. So we are completing anatomy by 24th May. So for the students who want to catch up, you can actually start even today. And 21, 22, 23, 24, the 4 days that you have, you can do the rest of the anatomy. And when you will have the Sundays off, you can actually complete the rest of the anatomy as well. Okay, so you can see that I've given you good enough time for the long subjects, for the short subjects as well. So 8 days for anatomy, 4 for ortho. We have followed a plan, a sequence where the subjects are interrelated. Okay, so remember that we have started with anat, then we are doing integrated ortho. Then we are starting with physio. Once you read physio, that forms the foundation for pharmac. Then comes psychiatry, then comes pathology, because psychiatry mein you will have psychopharmacology, a lot of drugs to be read there as well. Then comes pathology, dermatology, microbiology. Then when all of these subjects are done, your medicine, majority of the medicine is done. Then medicine will be actually like majority done. You don't even need 10 days for medicine, but I've given you good days because I am hoping that all of you will be revising also in the first read itself. You will not be just doing ek subject ke baad dusra subject, teesra subject, right? I'll be talking about that as well. Okay. So then after medicine come pediatrics. Pediatrics ke baad biochemistry, because here you would be reading about inborn errors of metabolism. Then comes FMT, PSM, surgery, OBGY. Then all the surgical subjects, surgery, OBGY, ENT, ophthalm, radio and anesthesia. So all these while I have given you all the Sundays off, and I have also mentioned that on which days you can actually give the grand test. So in the month of May, you can give only one. In the month of June, you can give only one grand test. And then starting from July, you can actually give a grand test 1 in 15 days. ठीक है? ठीक है. Anatomy में क्या add करना है first aid में? See, so in anatomy, the embryology part, every system gives the respective anatomy. So if you go to the cardiovascular system in first aid, you would be seeing the embryology part, the coronary circulation part, all of that. Add on the points from there. Okay, or basically you can keep the first aid also as a primary book. Okay, so now going on to the questions. How to go about this? So as I said that, whatever subject you would be starting. So like we have started with anatomy now. Okay, so the flow chart. Okay, how the flow should be going for your preparation. Karna kaise hai anatomy prepare. So the first thing that you should be doing is the PYQs, right? Because the previous year questions give you an insight into what the examiners are asking, how the trend of the exam is changing, right? So like on the Prepladder platform, you have the past year MCQs which are available separately. They are available as right, they are available as past year questions, subject wise categorized. So start with that. I'm not telling you to read the explanation. I'm just telling you that when you will start with anatomy, let's say the first subject you are starting with is anatomy. तो सबसे पहले क्या करना कि at least NEET PG के questions from 2017 to the recent year, have a just look at the questions, not the explanation, because that will give you a good idea into what questions, what topics are being asked. And if possible, please make the list of the topics that have been asked in the previous years. And actually, you should be making the list of the topics like section wise. कि हेड एंड नेक में से कौन से ईयर में कौन सा क्वेश्चन पूछा गया, ट्रायंगल्स ऑफ नेक पूछा गया, जीनियोग्लॉसस मसल पूछा गया, राइट, व्हाटएवर हैज बीन आस्क्ड. सो remember that you should be first making the list of the topics, because that will give you an insight that after having a look at the PYQs, now the next I would be going on is to the videos, right? So when you will be watching the videos, you will get an idea, your mind, your brain will tell you that, oh, this was a topic that has been asked in the recent years, so this is important and I should be paying more attention to it. Okay, so next, so the first is the PYQs, then is watching the videos. Now the major question is whether we should watch the main videos or should we watch the rapid revision videos on Prepladder, right? So let me tell you that I can assure you that we have the best of the team at Prepladder, right? So there's no second thought about it. So don't go into the FOMO of this platform versus that platform. Basically, the content everywhere remains the same. Okay, the content remains the same, so you need not worry about it, right? As educators, let me tell you that we also look into what questions are being asked in the recent years. Like when I make radiology videos, I make sure that I look into what questions are being asked in the recent years so that I can update, I can modify my lectures accordingly. and similarly all the educators, they do the same, right? So you get the best of the content, but the thing is whether to do main videos or to do the RR videos. Now personally, a person like me would tell you that even the rapid revision videos are good enough, right? So first of all, study something which is revisable, right? Because the most important thing is revising. Revision is the most important key. Okay, so a human brain does not have so much of space कि जितना भी इसमें information डालो सब कुछ आप याद रखोगे, that is just impossible. So you need to definitely revise. So maybe you can just do the rapid revision videos, and as I said, you can start with a subject. Let's say you are starting with anatomy and you are starting with rapid revision videos. But then you realize कि probably मेरे को उतना ज़्यादा, because I had not read anatomy well in my first year. It's been very long that I've read anatomy, तो मुझे शायद बहुत समझ में नहीं आ रहा है. Then you can switch to the main videos. So basically, to begin with, start with the rapid revision videos, which I'm sure would help you a lot. And if at all they don't seem to be adequate because our foundation is not strong, then you can go to the main videos. Or if you already know कि anatomy मेरा बहुत ही बर्बाद subject है, मुझे कुछ भी नहीं आता, मुझे anatomy का A भी नहीं आता है, so then you can directly jump to the main videos, right? So, and now when you are watching the videos, okay, so should you be making notes? How about making the notes? See, if you have been a person who has been making notes all throughout the MBBS years, please continue following the same. I'm sure that many of your friends will not be doing that, but if you personally have been in that habit of ki, until and unless I don't make my notes myself, I don't get that feeling of completeness, which is basically me describing myself. I am one of that person ki something which I don't scribble down, at least what I am reading, what I am listening, what I'm watching, I don't get that assimilation in my brain. So I prefer making my notes myself. But if you think कि नहीं मुझे ऐसे भी चलेगा, the ready notes which are available, right? So you get the ready notes on Prepladder platform for both the main videos and the rapid revision also. So all you need to do is just highlight the previous year questions, the previous year topics. I had given you a mnemonic for this as well. So when you are highlighting the previous year topics, what you need to do is P for pink, क्योंकि आपको याद नहीं रखना पड़ेगा कि pink का highlighter मैंने किसके लिए use किया है. So you can actually highlight the PYTs with the pink color. You can highlight some of the important topics that you thought in the grand test were important, you were not able to answer. G for grand test wala, you can do it with the green color. Okay, you can do it with the green color. So use specific highlighters right from the beginning, so that everything is organized right from the beginning. So PYTs I'll be highlighting with a particular color. Okay. So that is what you need to do. I hope this query is solved कि rapid revision videos करना है कि main videos करना है. ठीक है? So first thing to do is previous year question से पहले list बना लो कि क्या क्या topics पूछे गए हैं. Those are the topics to be mastered first, and then go on to the videos. If you think that this is a subject that I'm very confident about, maybe you can skip watching the videos also. You can just read the notes. The next step that you should be doing is, all the while you are trying to complete a subject, let's say the subject of anatomy, your main purpose of doing the first read is basically to concise and consolidate everything, so that during the revision, when I tell you that 4 days में अभी anatomy करना है, then I don't want you to get panic कि अभी मैं 4 दिन में anatomy कैसे complete करूँ. So basically the first read is for you to concise and consolidate everything at one place, so that during the revision, you just have to go to one resource, right? Then you don't have to jump from this resource to that resource and keep changing the resources. First read में इसलिए मैंने इतना टाइम दिया है कि जितना ट्राई करना है, जितना resources ट्राई करना है, कर लो. Out of all of those, I can definitely tell you that rapid revision videos on Prepladder are the best. They are time tested. You would see everybody talking about that, right? So in those rapid revision videos itself, you can add the extra points. You can use the rapid revision notes as the base resource, and to that you can highlight the PYTs, you can add the points from first aid, and yes, please also do the treasures that are available on the Prepladder platform. Right, so treasures basically are the most frequently asked topics that we have tried to consolidate on like one screen itself. So everything, a glimpse about that topic from all the subjects together is given together. So let's say for the example of inguinal canal, pharyngeal apparatus derivatives, right? So when I've given you the daily targets, oh yes, let me also tell you that along with the timetable that I have given, on my telegram group I also give you the daily targets. So when I said ki 16 to 24 anatomy karna hai, I've also told you that कि 16th को anatomy में से embryology करना है, 17th को upper limb करना है, 18th को lower limb करना है. So you know that much of hand holding and spoon feeding is what we would be doing, because as I said, being there, done that, I know that if this part is taken care of, you know, making a timetable, being accountable to someone, all you need to do is just focus on studies and not keep making new timetable every single day. Okay? So, based on that, basically you'll be preparing. So when I said on 16th, you would be doing, embryology. So in treasures, even in anatomy, the treasures are categorized section wise. So you don't have to do anything. So, you know, at the end of the day, when you are done with embryology, watching the videos, having a look at the notes, एक बार treasures देख लो. उसमें अगर लगा कि शायद notes में कुछ नहीं था, but treasures में ये extra point है, all you need to do is bookmark the treasure, and you actually don't need to write down the entire treasure. All you need to do is bookmark the treasure and write down the treasure number in your rapid revision notes, because assuming that you would be using that as the primary resource. Okay? So remember that you just need to write down the bookmark treasure number in your notes. On the first page, you should be ideally doing it. कि पता रहे कि जो भी treasures मैंने bookmark किए हैं is basically the additional information over and above the rapid revision, and that is what I need to see. Now after that, what comes is, so you have watched the videos, you have done the treasures. The next part is MCQ practice. Let me tell you, this is very, very important, and I feel that majority of the students make a mistake here, right? Please don't be under that misconception कि एक बार videos देख लिए, notes पढ़ लिए तो exam crack हो जाएगा. That's not possible. Honestly, let me tell you that. Because until and unless you develop those skills which are required to solve the MCQs, cracking these competitive exams is difficult. Only with MCQ practice, you realize, you know, you learn the skill of eliminating the option. Because MCQ exam का best है कि unlike like your subjective or the theory exams or the viva, कि where you have to answer everything, you know, खुद से, here what you have is, you have 4 options right in front of you. So even if you don't know the correct answer, if you can eliminate the 3 options, you'll be able to answer the question, right? So it's not about knowing the right answer, it's also about eliminating the 3 options and then coming to the answer. So these are basically what I call as cheat codes to solve the MCQs. कि eliminate करो. If there is contradictory option, you are sure that one of those is the answer. ठीक है, 2 contradictory options है. For example, iohexol is a ionic contrast, iohexol is a non-ionic contrast, and the question asks which is true or which is false about iohexol. So when there are 2 contradictory statements, you know that 2 contradictory statements cannot be true for iohexol, one substance. So one of that is true and one of that is false. So automatically the examiner has given you the hint कि आपको answer mark करना है, तो ये दोनों में से mark करना है. But when I conduct the quizzes, I've seen students who do mark the answers from the rest of the 2 options also. What does that mean is, we are yet to learn the skills of solving those MCQs. So this you would learn only with the MCQ practice and giving the mock test. Again, you have free mock test also available on the platform of Prepladder as well. So you should be actually practicing mock tests from multiple platforms. So for videos, for notes, you should be sticking to one resource, and I would recommend the rapid revision videos of Prepladder as primary resource. Mock test, I would definitely say that you should be giving from multiple platforms, because you get to see various types of questions on the multiple platforms, right? The group of the students, the number of students might also be different giving the test. So basically you are getting to experience a lot of that. ठीक है? So MCQ practice तो आपको करना ही करना है. Priya is asking how to practice the module, the subject wise test. So like I said, कि every day I'm giving you daily targets. कि 16th को आपको like tomorrow 22nd of May is neuroanatomy. Okay, so what you'll be starting with, presuming that you have a look at the PYQs कि neuroanatomy में से कौन से क्वेश्चंस आए हैं, तो एक आइडिया आएगा कि क्या इंपॉर्टेंट है neuroanatomy में. फिर आपने वीडियोस देखे, फिर आपने ट्रेजर्स देखे, और उसके बाद you are solving the MCQs of neuroanatomy from the Q bank, right? So basically the question bank. So we are working a lot on updating and revising the question bank. So you would see some very good questions in the question bank, which will help you in understanding the keywords and solving the questions as well. Okay. So remember that. Okay, Doc Anjali, I'll come to your query as well. So question bank से respective module आपको solve करना है, बस वही करना है दिन में. And this is something, trust me, which is very very doable. Whatever is the timetable that we have made is something which is very doable. Okay. And please start giving mock tests. Like the first mock test, like I told you today itself, 21st of May. So if you have not given a mock test, you have not even started your preparation, please give your mock test now, because it is basically to help you assess your preparation. Ki where are you standing? Suppose if you are asked to give NEET PG tomorrow, where are you standing? Where is your preparation? And using that as the baseline, you should be seeing your graph going just up, up and up until I see you cracking your goal. Okay? Okay, so next question, Dr. Mansi is asking like how to review the mock test. See, to review the mock test, the next question is that itself, right? So we resonate on that front. So how to review the mock test? So to review the mock test, you can, there are, two things that you can do. One is on the Sunday that you are giving the mock test. So let's say 21st of May, I have given the mock test. I will be utilizing that that very Sunday to complete the review as well. Okay? Because on that very day, my brain is very fresh with what I marked, why I marked something in the question. So you can complete the review on the same day. So when you are completing the review you can start with the wrong questions first, right? Because I don't want you to forget later on कि मैंने ये answer क्यों mark किया था while I was solving the mock test. So first is going to the wrong questions, then the unattempted questions, and then the right questions. And whatever you are learning from the explanation of the mock test questions, if it's a concept, if it's an extra point, there's something there, please add on to the notes if you think that is relevant. Something which is you think ये तो बहुत ही eccentric question है, you can skip adding that. But something which is important, you should be definitely adding to your notes, I would say. Because you have a lot of time and you are consolidating everything at one place, so you can revise it later on as well. The other thing that you can do is the mock test, NEET PG mock test will be 200 questions. You can review 40 questions every day from Monday to Friday. Right, so 40 questions every day from Monday to Friday. Take on, for example, an average of just 3 minutes per question. That is what you should be targeting. Another very, very important lesson and another very, very important point is use time boxing while you are preparing. Okay, use time boxing while you are preparing. What do I mean by time boxing? So let's say my next target for the day is I want to complete the review or the explanation of these 40 questions from the mock test. 40 questions, I'll tell myself 3 minutes per question. So it is 120 minutes basically. So all I need is 2 hours. Thoda 15 minutes or zyada bhi de diya, so 2 hours 15 minutes is what I'll be using. So let's say starting at 6:30 p.m. by 8:45 p.m. should be my target कि मेरा ये mock test का review खत्म हो जाए. So until and unless you give yourself those false deadlines, trust me, honestly, this 40 questions ka review will go on till the midnight if you don't give yourself those false deadlines. That's the law of Parkinson. जितना टाइम दोगे उतने टाइम में खत्म होगा. बोलोगे कि आज रात तक करना है, so it will go on till रात तक. If you tell कि no, in next 2 hours I want to complete, you'll be actually astonished to see that you are actually completing it. So that's the law of Parkinson, which says that the work expands to fill in the time that you are giving to complete that work. Okay, so it will just expand itself. So this is how you should be doing the reviews. Remember, mock tests make no sense if you are not learning out of that. Use mock test as a learning tool. I personally believe they are the best learning tool. They give you the MCQ practice. They also help you assess your weak subjects, the weak areas. So you get a direction कि कहाँ focus करना है. You are developing your time management skills for the exam as well. So giving the mock test is very, very important, and please give them very diligently. Now, what score is a good score in the mock test? So honestly, there is no such score as a good score. Your only target while giving the mock test is from one mock test to the next mock test to the next 3, 4, 5. My graph is only going up. So please do not compete or compare yourself with anybody else. Your best competitor is yourself, the yesterday's yourself. If you are improving every single day, so basically you are doing good, right? So I'll show you a slide which also speaks about do not strive for perfection, just strive for progress, be it very little every single day. Progress is much more important, right? Remember the story of the tortoise running the race when in the competition against the rabbit? So slow and steady definitely wins the race. Never, never forget that. Okay. So troubled man is asking how to use the question bank after the topic is completed. So as I said कि अगर embryology आपने खत्म कर लिया है तो बस embryology के question solve करना है at the end of the day. When you finish the entire subject, so 24th of May you are finishing anatomy. So what you should be doing at the end of 24th night, 24th evening basically is do a custom module, right? You also have the option of doing making a custom module on Prepladder app. So you can make a custom module where you make the anatomy ka custom module of all the PYQs of at least 100 questions, and then basically you are assessing yourself and seeing that how well you are able to answer those questions. Okay. And when I was talking about MCQ practice, like I said, पहले आप स्टार्ट करोगे कि PYQ से एक टॉपिक्स की लिस्ट बनाए, फिर RR वीडियोस देखें, ट्रेजर्स देखें. Again for the MCQ practice, go to the PYQs. Okay. So one day, one paper at least you can target depending on how many days you have for a subject and how many papers you have. So let's say 8 days है anatomy के, 10 पेपर है तो किस दिन 2 कर लिए, किस दिन 1 कर लिए. So थोड़ा थोड़ा साथ में every day you do one paper also of the respective subject. ठीक है? Avinash, not really. You need not make a 20th notebook for the grand test के explanations. So I personally believe in okay, 19 subjects, 19 books, everything added at one place for that subject in that one particular book. Okay, so I personally believe in 19 subjects, 19 books is something which I believe in. Yeah, Akshay, is rapid revision really enough rather than using full notes as my version of notes is old? Akshay, I would say yes. And the best way to assess the rapid revision is enough or not enough, maybe for a particular subject also is, first, read the rapid revision notes, then try to solve the PYQs. If you are able to answer all the PYQs just based on reading the rapid revision notes, that means that it was enough. If you think that नहीं इससे मेरे question solve नहीं हो रहे हैं, which is very very rare, I believe that will not happen. But if at all that happens, that means that you can go to the main videos for that. Okay, you can go to main videos for that. Okay. Aisha is asking how to improve the GT score. So basically, to improve the GT score, what you need to do is, so let's say my GT score in the grand test that I give today, out of 200 questions, I got only 80 correct. Right, so do not get disheartened if that is the case, right? So now what you need to do is analyze that which are my weakest 3 subjects, okay? Then work on them, try to convert them into the strong subjects. And the most important is, in the meanwhile, keep revising also whatever you have read. Revision is very, very important. So understand your weakest subject and every day give some time to that grand test weakest subject also कि एक घंटा पढ़ के थोड़ा सा along with the daily target as well. I am working on my weak subjects also. ठीक है? So the extra time that I've given you all this while in the timetable is so that you work on your weaker subjects also. You are able to do the grand test, the mock test review also. Okay? Okay. 5 years old guidebooks is thoda sa old, I would say, Vignesh. But of course, for the pre and the para clinical subjects, it is not very much different because the syllabus, the knowledge remains the same, except for like pharmacology having new drug updates, PSM having new health program updates. So subjects like those, I would suggest कि उसके लिए आप नए वाले कर लो, that would be better. Like for anatomy, for physiology, biochemistry, you can stick to the same. Just add on the recent questions ka information. You can also do a custom module in the question bank of Prepladder asking about just recent updates. So you will get all the recent updates at one place and you can add on to your previous edition notes as well. Okay, so Ruka is asking how to prepare along with job. So honestly, if you ask me, people who are working, people who are doing internship are actually the ones who are the most productive. Honestly, if you compare a person who has entire 24 hours in the day to their rescue की जब जो करना है मन में आप कर सकते हो, that person will waste a lot of time. The Parkinson's law, remember? Otherwise, if you have an intern or a doctor who's working and preparing for NEET PG, 8 घंटे तो ड्यूटी है. So there is something at the back of your mind telling you कि I don't have much time to study. So you will definitely study with better attention, right? So first of all, please get this thing out of your mind because I'm an intern or because I'm working, I'm not getting enough time to work. Your whatever time you are getting is enough to crack the exam is what I can tell you. All you need to do is while you are working or while you are doing your internship, जितना भी छोटा छोटा भी टाइम मिलता है, even small time breaks that you get, be it as small as 5 minutes, make sure you are using those 5 minutes to solve 5 MCQs, at least the previous year questions. As I said, the best part about digitization, the apps is you just need to carry your phone. और कुछ नहीं तो at least previous year questions solve कर लो. That is the minimum that you can do during your break times. Right? Utilize your time in the hospital more for revision rather than reading something new, because reading something new takes a lot of concentration, requires a lot of concentration. But revision is more like will be more passive. So unknowingly you'll be revising many times when you are in the hospital itself. So whatever you have read yesterday, guys, please try to revise the next day itself. I'll be talking about that as well. Yes. So first thing that I was talking about is strive for progress, not for perfection. Don't try to be a perfectionist. That's never possible, right? You are not doing PG in 19 subjects while you are preparing for NEET PG. You just need to do the important stuff. Don't get into the FOMO. कि ये नहीं पढ़ेंगे और if I get a question from this topic which I have not read, then what? If I'm not read this, then what? Right? Not really needed. Your first target is to master the previous year topics. Your first target is that when you're preparing for the exam. Okay, Pratibha, image-based questions. Again, custom module comes to your rescue. Make the custom modules of just the image-based questions. Okay. Hetal, how to go with pharmacology. It's very volatile. Try watching some videos. There are some videos on the Prepladder YouTube channel also where we talk about the mnemonics, right? The easy tricks. Without mnemonics, these subjects become a bit difficult. So you should be definitely trying your hands on mnemonics also. Okay. Okay, Nihar, I think the best person would be the Unacademy team itself. But yes, please do share me your details. I'll escalate this and I'll share the details with the team as well. Bhavika, handwritten or printed notes. Like I said that if you've been a person who thinks that without my own handwritten notes, I don't get that feeling of completeness, go for handwritten notes. But that does not mean कि पूरा copy कर दोगे printed notes. It is just like one topic, one page should be your target. ठीक है, बस उतना ही target होना चाहिए. Is first aid enough for pharma? I will not say कि yeah, it is enough for pharmacology. It is good, but I would not say that it is enough. Right, and some of you were also asking that when to start reading the first aid along with the daily targets that you are following. So like I said, anatomy, when I tell you कि neuroanatomy है next target कल का, तो first aid में से neuroanatomy वाला part भी कर लेना, right? So if you want, you can use the rapid revision notes and the first aid together and keep like 2 resources is what I would be using for the final revision also. But of course, with the highlighted areas. See, next time in the revision, you know that these are the only things that I need to revise. Vignesh, I'm getting sleep disturbance few months before exams. How to tackle it? I think that we the medicos need to work on our mental health and peace a lot. So please try some breathing exercises, some meditation techniques, some relaxation techniques. Trust me, they help a lot. Okay, so they do help a lot. Do work on them and let me know whether they help you. Anamika, not able to memorize what I study. So yes, this is the key for you. That is revision, revision, revision. जब कुछ याद नहीं हो रहा है, one way is revising it so frequently that your brain also gets tired now कि बस हो गया. Now this has gone into my permanent memory. No more revisions required. Right? Because there's something called as the forgetting curve. So this is what is the forgetting curve actually, which tells you that the speed at which we forget is very more initially. अगर आप देखो कि this is the number of days and this is the percentage of what we are reading, we are retaining. So if you see that whatever you read on day 0, okay, you are actually remembering only 50% or 60% of that on day 2. So initially the speed at which we forget the things is much more. So if you revise initially like very fast, that is why I always talk about whatever you read on day 1, revise it on day 2. Whatever you read on day 2, revise it on day 3. Trust me, if you do that, you'll be in a very, very good position later on when the revision comes. नहीं तो फिर रिविजन के टाइम पे क्या होगा कि वापस वो फर्स्ट रीड हो जाएगा. योर रिविजन एक्चुअली विल नॉट बी अ रिविजन. ठीक है, सो इसको आप बार बार रिवाइज करते रहो. दिस इज द फर्स्ट रेपिटेशन. You can see that you are remembering much better. Second repetition, you remember much better. Third repetition, of course you remember much better. And fourth repetition, it is even more better. Right? So revision is the only key. So if you are not able to remember something, revision, then the second thing that comes to your rescue is the mnemonics. Basically the easy tricks to remember the topics. Don't make mnemonics like A, B, C, D. These are the ones which itself take a lot of efforts to remember them. Have mnemonics which have visuals, which have stories, which are interesting, which are fun, which are eccentric, that automatically stay in your brains. Maybe you can try some videos. You can search for my mnemonics as well on YouTube. You will get an idea about that. Okay? Right. So revision is the key. Revision is the key. And very, very important, stick to one resource. Again, something that I would like to reinforce is have the faith in that one resource that you are using. Otherwise, in the end, everything will get jumbled up. Like I said, MCQ practice you can do from multiple platforms, but the videos and the notes, you should be sticking to one resource. And for me, that one resource is the Prepladder's rapid revision notes and the videos. I personally love them a lot. And this is true not just because I'm here on the Prepladder platform as a faculty. I'm talking about that even before I was here on Prepladder, I always admired the rapid revision notes. They are very, very concise and they give you what is required for the exam. Okay. Right. And yes, now coming to the don'ts, what you should not be doing. अभी तक हमने बात कर ली कि क्या क्या करना चाहिए. Now coming to what you should not be doing. Please do not get into the greed to read. ये भी पढ़ना है, वो भी पढ़ना है, वो भी पढ़ना है, ये भी पढ़ना है, मत करना. Whenever you are starting a subject like anatomy ongoing, make sure that when I'm reading anatomy, these are the resources that I'm using before day 1 itself. पहले ही पता हो जाना चाहिए. अब next subject ortho है anatomy के बाद, तो decide कर लो, एक overview ले लो. Whatever resource you think is the best, stick to it. Okay? Do not get into the FOMO, the fear of missing out. My friend is using that platform. My friend is using that resource. No, not really required. Okay? Third, do not burn out. Right? So initially with all the enthusiasm, 10 घंटे 12 घंटे पढ़ लिया और धीरे धीरे the energy is coming down and then you get into the burnout stage. Please don't let that happen. So what you need to do is take frequent breaks. Okay? Take frequent breaks, and that is why I've given you Sundays off. So those Sundays off you can use to relax, to rejuvenate and to revive yourself. You can also use them to revise. You can use them to complete your backlogs if any. You can use them to give the grand test. So depending on what is your state of mind on that particular Sunday, you can utilize that Sunday which I have given to your decision कि आपको क्या करना है, आप कर सकते हो. ठीक है? So take breaks. These are very, very important. If you don't take breaks, then you will break down, which I don't want to happen. So use breaks, stretch out. Exercise is actually very important. Go on a walk. dance, music, sports, whatever you love, whatever has been your hobby, but continue pursuing them. ऐसा नहीं है कि नीट पीजी की पढ़ाई कर रहे हैं तो बस एक बंद कमरे में you have to sit and that is where your world is. Not really, right? So don't give up on the entertainment part as well. So the mantra should be study while you study and enjoy while you enjoy. That's the way to get the best ranks in these exams. Okay, Vignesh, it's not really required. You need to read for long hours only. Take breaks. They actually help you to come back with a much better momentum. Akshay, so see, first of all, whether the PYQs are enough or you need to do the entire question bank, I would say that start with the PYQs, then see that how you are doing in your grand test. And if you think that, I'm not able to score more, then you can do the entire question bank. Because if you're doing only PYQs, so if you are going only with PYQs, then I would say कि भाई 10 साल के PYQs तो आपको करने ही पड़ेंगे. Then it's not just 3 years and 5 years of PYQs, then you need to go for 10 years PYQs. Otherwise, the number of questions that you are practicing is actually less. Okay? You need a lot of MCQ practice. I would also recommend practicing some USMLE pattern questions. Like those are also available on the Prepladder platform. When you are making a custom module, make the custom module with the clinical MCQs. Those are basically the USMLE pattern questions. Oh yes, Neha, how to prepare for INI-CET questions? INI-CET questions are very different from the NEET PG questions, and because a lot of the questions are multiple options correct, that means that the depth of the topic is being asked. So I would recommend that you can try solving the PGI के questions. जो PGI चंडीगढ़ की exam पहले अलग से होती थी, those questions you can practice. You have a book by Dr. Manoj Chaudhary which was available at that time, so maybe you can get that and practice those types of MCQs from there. Okay, that's the practice that we need for INI-CET. Okay, Komal, how do we memorize anatomy and physiology? By anatomy is all about visual information and visual memory. So make schematic diagrams, have atlas by your side when you are studying anatomy. You can watch the YouTube videos, will give you the 3D orientation on how actually anatomy is. Physiology is all about concepts. Somin Mana sir is, I believe, the best faculty for physiology on who's there on the Prepladder platform. You can try watching his videos, right? They are really good. So Anamika is asking for where I get 10 years PYQ. So all the apps basically give you 5 years ke questions. So the guidebooks, the previous year questions, the guidebooks are available from where you can get the previous year questions. So you need to go to the stationery and get the book from there. Okay. Naga Dikshita, almost all the platforms give the free mock test, the free grand test, right? So make use of those free tests. If you are subscribed to one platform, then you can make use of the free platforms, the free test as well to practice more questions. Hardik, how we prepare for NEET PG in final year? Your final year subjects are very important and high scoring. So especially when they will be next, they will be becoming very scoring. So make sure in final year you are done with your final year and the short subjects as well. Okay, at least focus on that with the MCQs. You should be thorough with all the previous year questions. So basically 8 to 10 subjects you should be targeting in the final year itself. Okay. Right. So that if you think that there are few questions that I'm not able to solve from the RR, just add on those PYQK topics, the PYQK points, the explanation K points to the RR. That is how you are using your self-efforts to complete the RR, right? MBBS, I am studying for university exams thoroughly. Is it sufficient for NEET PG or more information? If you want to prepare for NEET PG right from the beginning, I would say that practice MCQs right from the beginning, participate in the quizzes that are being conducted in the colleges. That help you develop your MCQ solving skills from the beginning itself. Right. So Neha, the previous year questions list is what you need to form and do those particular topics. If they are not available in the videos, you can do it from the reference books. That is what you need to do. Oh yes, Kartikeyan, like I said, suggestion about first aid. I would agree that it's a very good book, but at the same time, it's a book which is a bit difficult to assimilate because it's so much high on information. In every single line, there's so much of information. So First, complete the subject, then read the relevant part from the first aid. And if there's anything extra that you see in first aid which was not in the notes that you read, बस उतना पार्ट हाईलाइट कर लो या अपने प्राइमरी नोट्स में ऐड कर लो और फिर रिवीजन के टाइप उतना ही करो. Right? So that should go hand in hand in the first reading itself. Your target, as I said, is keep from the revision 1. I have only one resource where I will be going to. I will not be going here and there for revision. I will not be wasting my time into getting everything at one place during the revision time. Oh, Dr. Abhinav, a good question. How to kill the inferiority complex of being an FMG? There are amazing videos available on YouTube that tell you about the stories of the FMG students who are pursuing their residency in AIMS as well. Yeah, so anybody who feels demotivated, that's the whole purpose of we doing the interviews after the exam. It's not about boasting about the platform. It is about telling you that how a person who was in your shoes yesterday is now on the other side and now you too can. So there's a reason behind doing those interviews. So whenever you feel demotivated, do watch one of those videos where you feel that it is relatable. I'm in the same state, like I've got 60,000 rank. There'll be so many interviews available telling you from 60k rank to less than 1000 rank. तो वो वाले videos थोड़े देखो idea आएगा कि how that person overcame all the feelings that you are going through right now. Okay, as I said, PGI questions is something that I believe should be added on for INI-CET practice. Rohit, custom module, I will say first. पहले custom modules prefer करो, that's better. Rapid revision enough होगा NEET PG के लिए? Yes, your 85% of the questions can be definitely solved by rapid revision itself. So from the previous year questions that you would be solving, from the question bank, from the past year MCQs, from the custom modules of the previous year questions, add on those missing areas to the rapid revision. Rohit, as I said, custom module. Right. So yes. So what is the takeaway point from the today's session? The takeaway point is everything seems difficult until it is done. I was talking to one of the students yesterday who's actually an FMG student, and she has cleared the exam in the first attempt itself. And then she was like, ma'am, cracking FMG exam is so easy. Like, we just have to score 150 out of 300. I don't have to worry about the rank, nothing. And then I actually laughed and I told her, imagine what situation you were in this, before the exam, 2 months before the exam. That same girl had come to me and told me that, ma'am, it seems so impossible, so difficult. कैसे करना है, क्या करना है, कुछ समझ में नहीं आ रहा है. So you see that everything seems difficult until it is done. Once you will be on the other side, you will realize कि फालतू में टेंशन ले रहे थे, फालतू में इतना हाइप किया है सबने, इतना कुछ है नहीं जितना डिफिकल्ट वो लग रहा है. Right? It's very much doable. Right, I said, the right direction is much more important than the right speed, and that is where we, the Prepladder Dream Team Next Edition, work towards helping you towards giving you the right guidance. You see that we come so often with the live sessions to help you with the same. Okay, so keep going. You can do this, and no matter what, do not give up. It's only when you do not give up when the magic happens. Sooner or later, your hard work will pay off, and always remember that your success can be delayed, but it can never be denied. आज नहीं तो कल सबका टाइम आएगा. किसी का आज आएगा, किसी का कल आएगा. All you need to do is be patient, be consistent, and be that same passionate and determined person. Right? So, thank you so much everyone for joining in. I hope this has given you a clear idea. So, if you have not started following this timetable yet, please start following this timetable. I'll be posting a lot of daily targets, the related videos, the resources, all of that, and we'll stay connected there. Okay? So, yes, Nadia and everyone here, thank you so much for those kind words. If this helps even one person, my purpose is solved, right? And my Sunday is fruitful then, right? So let's take a pledge to give in our best and make ourselves proud more than anybody else proud. And again, to reiterate, I am always there by your side, hand holding you and helping you in this journey, right? So we are definitely in this. We are together. Okay, we are in this together, and we are going to do this together. Thank you so much, everyone, for joining in. And goodbye. Take care and keep studying, keep revising, and keep winning. Thank you so much.